Today we're going to talk about something that I feel like more women experience than you might guess.
I grew up my whole life knowing this is bad, and then it happened and it was terrible, and then it's been terrible ever since. Like, what body craves that, you know? So for me, when I talk about low libido is very complicated, but the root cause of a lot of my low libido has been pain. How have I not heard of this? I have been trying to fix this for so long. I am a doctor. What in the world? There's like no pain. With those two things, zero. Whereas before, there would always be pain, but I would override it. And this is insane. I've never had this experience ever in my entire life. Welcome back to Healthy as a Mother. I'm your co-host, Dr. Leah Gordon, and this is the show for becoming and being a mother, where Dr. Morgan and I share the natural women's health and motherhood guidance you've been looking for through a fresh, functional, and balanced lens. And today's episode gets really vulnerable, but hopefully very helpful because we're talking all about painful sex. This is something I have dealt with personally for many years, and I can confidently say that I feel I am on the other side of it after 18 years. It's a very complex chronic issue, at least for me, that is very misunderstood. And I did not get a lot of support or understanding from people along my own journey. And so I really wanted to be able to share everything that I've learned of the root causes that can lead to this condition and how important it is for you to find your root cause so that you can be targeted in treating it. And this is true whether you are before having kids, if you're on the fertility route trying to conceive, if you're postpartum, or if you are outside of your reproductive years. Sex that hurts can affect anyone along that spectrum. And so, yeah, it's a pretty information-packed, personal, vulnerable, but hopefully empowering episode. So let's get started.
Hi, everybody. Okay, we are back, and today we're going to talk about something that I feel like more women experience than you might guess. And if you're one of the people, it can be very isolating because it's not something that's super fun to talk about, or you might feel like an outsider. But we're here to tell you that unfortunately, it's not that uncommon, and there are a lot of different reasons why it can happen. It doesn't have to be the entire rest of your life. There's solutions. And Dr. Leah, you have a lot of personal experience with this and have deep dived into this entire thing and helped so many people with it, which I feel like is really unique. And there's not that many people out there doing what you're doing, understanding it to the depth that you understand it. And, you know, it's because we have our own experiences with things where we find that kind of passion and that fire under our butts to really, really go into it. So today we're going to talk about a lot of different root causes and some ways to approach that along with your personal story. So why don't you just go ahead and take the lead.
The leap. I'm going to leap into the lead here. Oh, I love it. Yes, thank you for the intro. So this is a topic that's very near and dear to my heart because it's something that I have struggled with most of my life. And although I feel like I'm a pretty well-resourced person, I'm a naturopathic doctor, I know a lot, I still feel like I don't understand this fully, and I'm still learning new things even now after years and years and years of trying to figure it out and see tons of people and do all sorts of research. And I actually spoke with someone in sexual medicine a couple months ago, and she said that for so long, as so many things are, we don't do research on women or do anything for women really. One, because there's usually not like a financial incentive, and two, we're complicated as females, but there wasn't a lot of knowledge or information on painful sex for a long, long time. There have since been some books written. That one of the books, called When Sex Hurts, is something I found in my pelvic PT office, and it opened up my eyes to even more areas that I didn't understand, even though I had been trying to figure out and solve this since I was 18 years old. So it was written, only a couple years ago. In my pursuit of trying to solve this, there wasn't even information on it then. And, you don't know every single book that comes out. And so anyways, I say all of that because I will be sharing my story a little bit throughout this podcast. And once you know the things, like now that I know, It's sort of like a duh aha moment. But with anyone who's dealing with something chronic and you're going doctor after doctor and being dismissed and no one understands and no one gets it, it feels like such a long uphill battle, and it feels like no one can help you, that it's the most confusing thing. You'll have it forever. And then when you find it, like some people have this experience when they realize that they have Lyme disease or mold toxicity or endometriosis or something, where they're like, "Oh my god, you told me that," and now it's like everything makes sense. That's how is that even a mystery? How did anyone not catch that? It's so obvious. But for a lot of people, their experience is that that's not what happens. And it's years and years and years and tons of doctors and trying to figure this out until you actually find the answer. And then it's sort of like, what? Like it was there the whole time. This is so obvious. And that's sort of what happened with me. I felt very confused and in a sea of just like terrible experience and confusion and not knowing what's going on. And so I absolutely understand when people feel dismissed by doctors when they have something chronic that is never going away, that they try and try and try for years and years and years, and it's like really ruining their life. I've been there. So yeah, anyways, to just tell my story a little bit,
Mm-hmm.
painful sex, when I first, like my first experience of intercourse was not necessarily my choice. And that played a big role in my issue, but I didn't really know it any other way, right? So my first experience, not really my choice. I met my husband not long after that. And when we became sexually active, sex was already painful, and it was painful the whole time. Like I've never not had it be painful. And that is tricky because I didn't really have a thing to base it back on. Well, this is what it should feel like, and it's not feeling like this. Therefore, I know what it used to be like, and now I know, it's just, I only had that one experience of it hurts. And so it was really hard for me to tease out what is even normal, and is this how sex is supposed to feel? And gosh, if this is what it's like, why does anyone want to do this? Like, this is terrible. Like, what is going on? And so I just didn't even understand or have a point of reference. And I had wished in so many ways that I had, but I didn't. That wasn't my reality. And so I basically have been dealing with this the whole time that I've been sexually active, and with my husband, who's been so patient and so amazing. And we've gone down all sorts of different treatment routes and different healing modalities and different therapies. And we're going to try this. Now we're going to try this. And he's been so patient and kind and loving. And it's interesting because I was talking to him the other day in the car about just our journey, because we've actually, I think, really solved it and figured it out. And we are now, I feel like we're on the other side of this, which it's what, been 18 years almost that I've been dealing with this. And I feel like I'm finally on the other side of it after all of that. And there was a part of me that never thought I'd ever would be on the other side of it, because when it happens for so long and that's all you've ever known, it's like, surely this is probably going to be the rest of my life. Even though I didn't want to believe that, it was really hard to ignore the data in front of me that it was just never getting better no matter what I did. And now that I feel like I've kind of cracked the code on my situation and we've actually solved it, and I'm now having like pain-free sex, or at least as pain-free as I can given the tools and things that I need to use, I told him, it's like, for me to have the depth of understanding, not only cognitively about this topic, but also the lived experience of it, to really understand what people are going through, I don't think a lot of women and or couples would have made it through for as long as we have, given this obstacle, where they wouldn't have had the opportunity to go so deep and uncover all of this shit that I've had to uncover and do all of that work. Because for a lot of people, when it gets hard, they just leave, right? Like they find a different partner, or they don't have sex, or, they don't have sex and then they get divorced. Or like there's so many different scenarios that can happen. To have a partner like my husband, who has been so supportive no matter what, and has never like shamed me or made me feel bad, and like has just supported me, has allowed me to now get to this place where I can turn around and help so many people and feel so proud of my own body, of like all of these things. And it's just a unique experience, because I don't think a lot of people, being a doctor like me and having this experience, also have a partner like him that would have allowed that whole thing to come into play. So similar to our fertility journey, right? Like I also have this whole chronic fertility thing that we went down, that we've just been navigating this parallel paths and fertility and painful sex and the libido for almost our entire relationship, yet we're thriving despite that. And when I reflect on it, it feels really crazy.
Yeah, I mean, not many people will be able to get through both of those things. A lot of people don't with either one of them, and then now double whammy both of them at the same time. It is a testament of your guys' relationship and like, your communication and whatever it is that's keeping you together like through all of
Mhm.
those hard times, and his patience and his perspective, of course. And it's been interesting too because as your friend for since we were like 19, 18 or
Mhm.
19. So almost is that what how old are we? We're 30.
I met you 1 year after I met Mike. So we'll have been together, like have met 18 years in September. So you and I are probably 17 years and
Oh
like
my gosh. Wow.
that's
Okay.
crazy. You're my longtime friend.
Oh my gosh, we have known each other for such a long time. We're really good friends. um, but it's been interesting too, because like sometimes you'd have seasons where things were like a little bit better. I remember after Avia was born,
Yeah.
your so many of your reproductive, like you no longer had painful periods and
Mhm.
sex for a period of time. I remember you saying like, oh my gosh, it doesn't hurt. This is like the best that it's been. And it's such an interesting thing because it ties in, and I know we'll get there, but it ties in hormones, body work, like physical, actual, and anatomical things, and then hormone, chemical receptor things. And, there can be so many things. And as my favorite analogy, you love analogies, I love analogies. This is really the only analogy that I continually talk about because it makes so much sense to me is like there's multiple cogs in the wheel. Like
Yeah.
there's always there's probably like 12 contributing factors to any
Yes.
one issue or concept. And often, and what we want to say and what like conventional medicine says is that there's one here, take
Yep.
this one pharmaceutical with this one
Mhm.
isolated constituent to tackle one mechanism of action for how this
Mhm.
might work.
Yeah.
And oftentimes they pick a very strong one, and so it's going to push a pathway or it's going to cause some kind of symptom change, but that's it, symptom change. It's not root cause based.
Right.
And if you really want to get to the nitty gritty, I mean, I understand it does take more time, it takes brain power, it's exhausting. Like patient care is really hard.
Yeah.
And I haven't done it nearly as much as you have, and it's like there's a reason why naturopathic doctors are so good at actually changing people's lives too, because you have to get down to what exactly is going on for this person, because it's not the same for the next person who comes in your office with the exact same set of complaints.
Yeah, it's probably one of my biggest pet peeves. And I understand the world of social media, and I've had to play into the algorithm and myself. It's like three top things for low libido. But what I really want to say is literally none of that will work if that's not the root cause of your low libido. Like taking a aphrodisiac is not going to help if your low libido is because you have painful sex.
Yep.
There's so many times everyone experiences their own bias and their own triggers because of their experience. Like, I don't know what it's like to be a person of color. I don't know what it's like to be in any sort of marginalized group, right? But I do know what it's like to be in my own version of that in the medical space I know what it's like to be for people to assume that our fertility struggles are me. I know what it's like in the libido space. I just want to like roll my eyes sometimes because I'll go to things around libido and it's just so blanket, like do this thing, whatever, and like take magnesium, it like increases blood flow. And it's like, okay, but like, yes, that would work if blood flow is your root cause issue. Or yes, like this thing would work if XYZ. And so I love that you brought that up. There are so many cogs in the wheels. So it's twofold, right? There are multiple things often happening, and a lot of times they play on each other. It's very much true in painful sex, which I'll get into, but it's true in a lot of things. If you have a nutrient deficiency that affects your thyroid, that also then affects, your hormone production. And so it's like everything's so connected. We do not have usually one thing that's doing it. So like you said, many cogs in the wheel. And two, it is really dependent on your root cause. And to be effective in any way, this is why when I see one-on-one patients, I spend an hour and a half understanding every single thing about you. Because if you come to me, almost everyone comes to me with the same list of ailments or the same goals. Like every single person, that is almost exactly the same. But how I would address and treat that person is completely different because the root cause within you is very different than the root cause within somebody else. Even though the symptoms seem similar, you will not be effective if you just quote unquote treat the symptoms. You have to treat the underlying factor. And if you take the time to actually learn it and know it, then you can be really targeted and really specific and cause immense change. And the biggest struggle for me with painful sex is that I didn't know what the root cause was, even though we knew so much about root cause, right? In school, we learned so much about gut health and autoimmunity and the immune system and blah, 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 but no one taught us about painful sex. And even in the fertility space, there was limited knowledge. And so, how do you be targeted and effective when you don't even know what it is that you're treating? And a lot of that issue was that a lot of even the professional people didn't know that it existed, you know? So it's a newer thing, and I understand why people are in the dark. But I was talking to a woman the other day. She was trying to conceive and was just beside herself crying because she wants to have a baby and they literally can't have sex because it's so painful. And I'm not even kidding you guys. Like I've known, I was, this was before I had this new awareness and awakening of this new root cause that I'll share with you. I didn't know it at the time yet. And I told her I was holding space for her, you know, and I was like, I get it. Like I've been there. I could hold space for her. But I also, in my mind was like, I don't know how to fix this. And now I need to reach out to her because she actually ended up having enough, you know, intercourse to actually get pregnant, which I was so happy for her. But now I'm going to tell her this. And it's like, I didn't know it and she didn't know it. And her life was crumbling. You know, her husband was upset. Like they couldn't have a baby. I mean, all because of this thing. And if she just knew this one root cause and how to treat it, it's like, oh my God, her whole life could have potentially, you know, and it will be different. Anyone listening to this, it will change everything. So, yeah. Did you know that while 97% of women take a prenatal vitamin, over 95% are still deficient? That's why I love recommending Needed's Prenatal. Unlike most prenatals, Needed doses nutrients in the right forms and amounts that go above and beyond to really support both mama and baby. I actually worked with Needed for years. We spent over 3 years researching, working with practitioners, and really intentionally choosing every single nutrient form and dosage that's put into the prenatal. And now we have the data to back it up. In an IRB study, they found that the women who took the Needed Prenatal had higher blood levels of key nutrients like vitamin B6, vitamin D, vitamin B12, riboflavin, vitamin K2, and selenium, compared to women who are taking a regular prenatal. Even more powerful, only the Needed group had significant amounts of vitamin D in their system, which is essential for supporting the immune system, bone development, blood sugar, blood pressure regulation, and so much more. This study reinforces what we've known for a long time, that real nourishment really makes a difference, and the proper nutrients support fertility, pregnancy, and baby's health. Needed isn't just aiming for adequacy, they're supporting what's possible. No matter where you are along your fertility or pregnancy journey, Needed is what I recommend. Head to thisisneeded.com and use code HEALTHYMOTHER to save 20% on your first subscription order. Again, head to thisisneeded.com and use code HEALTHYMOTHER to save 20%. Okay, now back to the show. Anyways.
No, I love it. I love your passion. I think that it's really important because it's like we have an episode that I did with my favorite IBCLC about low milk supply. And I think we go through 17 potential causes
Oh,
for
yeah.
why people have low milk supply. And it's like you cannot just take herbs and that's it. You cannot just
Mm-hmm.
power pump and that's it. Like that may not change anything for you
Mm-hmm.
in that thing, you know, and we need to do full assessment. And oftentimes too, you're tackling multiple of the bigger cogs. You know, say there's like a couple cogs that are like a 5 to 10% contributor. Those maybe can wait while we tackle some of this bigger bulk and get that sort of done and out of the way and focus on that. And then now we can tease around with these like littler, smaller things. It's just that a lot of people don't even know that that's a concept, or they don't want to do it, which I get because it does take a lot more work and intention. But so, okay, why don't you lead us through what are the main causes of painful sex?
Yeah.
And what can people do about it? And then I know that there's like, because there is so many too, at some point you'll just be like listing them off, but you're going to go a little bit more in depth about some of the main few that would be like the bigger bulk of, you know, society. Like if there was a pie chart, different than the cog analogy, but if there's a pie chart, it's like these three would capture like, you know, maybe 60, 70, 80% or something of the painful sex. And then if these don't sound like you, continue to listen onto the episode because we're going to list off all of the other reasons and causes that can be the thing. And it's like, that might be, you know, three of those might be the reason for you.
Yeah.
But as doctors and as educators, podcasters, it's like, I mean, we got to start somewhere. We got to just sort of talk about what's the most common thing to affect people negatively.
Yeah, such a good point. And so I'll start with probably one of the most common and completely misunderstood reasons for painful sex, and that is endometriosis. Endometriosis is a very complex condition that we are also still kind of learning about. It seems to have a lot of root causes as well. There's a inflammatory component with estrogen. There seems to be a detox component with estrogen, but what's really happening is that the cells that lie in the inside of the uterus have migrated somewhere else. They leave the uterus and they're maybe in the interstitial space, which is like in between your cells and your organs, or they are in your bowel area or whatever. Yet they behave just like the cells that are in your uterus. So when you have a period and there's inflammatory prostaglandins and things that are causing your cramps, they happen other places too, not just in the uterus. So you can have pain all over. Endometriosis is very classic when you have painful periods. That's a very common cause of painful periods, but it can also cause painful sex. And so when people say, oh, I have painful sex, it's like, okay, well, what does it feel like? Because that's the first kind of clue as to where to start looking for root cause.
Mm.
Endometriosis pain is deep. So if you're having penetration and you have deep pain, like, you're having deep penetrative sex or quick or fast sex and it's like, oh my gosh, like somebody like hit me up deep. I'm feeling something deep inside of me that hurts, and or it like lasts for a long time after, or it is positional. So there's certain positions that you're in and things like that. That can be a sign of endo. Now, the cervix changes height throughout the cycle for a woman, and so it is a little bit more common for there to be uncomfortability if like a cervix is being hit during penetrative sex around like the period when your cervix is low. However, if you have really painful periods and you're having deep penetrative sex, it's definitely something to look into because endometriosis might be what is contributing to that. You can also have other things that aren't endo, but like adenomyosis, which are growths. So you can have growths in your uterus, like big tumors and things like that, that can hurt when you have deep penetrative sex. So there are also things like infections. Infections of the cervix can absolutely also cause deep penetrative, sex because your cervix is inflamed because there's an infection there. But if you go to your OB-GYN and get a pap smear or do any sort of vaginal pelvic exam, which I know can be very painful for people who have painful sex, which we'll get to. But if they do that and they swab you and they're like, everything looks normal, like that's what I went through my whole life. I'm like, tell me something's wrong. Like, is there something up there that you can see? Like, what's going on? And if you've done that kind of investigation and there's no infection, then I would definitely be looking at an ultrasound to rule out any sort of, masses. And then if not, start down the path of endometriosis. If there's an infection, obviously you treat it. That can be a common cause of, and it doesn't always have to be an infection up in the cervix. Sometimes you can have bacterial imbalances and infections lower in the vaginal canal as well. So just that's a simple test. You can even do tests on your own, like EVI or other things to just see if there's anything there, but getting an actual, doctor to look at your cervix can be helpful. In endometriosis, it doesn't look like anything. You can't always necessarily tell that something's going on. So that's a big thing is like, oh yeah, sex hurts up deep. Okay, that's very different than sex hurts right at like penetration, like right at the opening. So if sex is hurting right at the
Wait,
opening,
wait, wait. Sorry, really quick before we go
yeah.
into a different one. Okay, so I get that endo migrates, which like the only way it can leave is through the fallopian tubes, correct? How do
That's
the cells leave?
that's a good question. I don't know if they know that. I mean, it could technically go up through the fallopian tubes and out through the fimbriae, and out and about, but that's a good question. I don't know.
Yeah,
I'm
how
sure
does it get
you
out there?
knows
Maybe
that
your body like
somewhere.
somehow dysfunctionally is just like with stem cells is creating it out there and
Yeah,
it
it's
shouldn't be there.
possible. It could be like that for
Okay,
sure.
but so like why let's pretend I have endo lesions like moderate. And
Hmm.
then now I'm having sex in my vagina. Why is it hurting? Just because the whole area is getting kind of like jarred around?
So, a couple of reasons. Endometriosis is really inflammatory. So if you have endometrial tissue that has migrated and moved and like is in certain places, then it can cause pain. Infection is also inflammatory. So things that cause inflammation are going to hurt usually, especially if you touch them. Like if you have a cut on your arm and it's infected, which not a lot of people like have that experience, but if you did and you touched it, it would hurt. And it's because of the inflammation that's trying to heal it, but inflammation causes pain. So with the inflammatory tissue of endo, if it's lower, in the cervix area or around your ovary or anything in there, it can cause pain just because it's inflammatory. Sometimes the tissue has grown so much that it's actually pulling on certain things. So sometimes the tissue can pull on your ovary, it can pull on your uterus, it can cause adhesions where they're actually stuck and pulling on your bowels, it can wrap around your bowels, it can wrap around like all sorts of stuff. It can get really gnarly. So it can cause pain because there's no fluid movement of your organs, and it's just there's like a lot of stuck like scarry tissue type feelings, and then there's that inflammatory component as well. But it's a good question because it's like it's in your vagina, why would you be feeling pain? But
Mm.
it's why it's so deep, because you're hitting something that's up above the cervix or like around the cervix. Some
Wow.
women can have endo but don't have pain with intercourse because their endo lesions are not positioned in a way that would trigger that, you know?
And there's a gal in my current 6 week pregnancy call who has stage 4 endo, like really bad, and has had two pregnancies now, both conceived within like 2 months of her surgeries.
Yeah.
Like as soon as they removed the adhesion, I mean, there was a lot of other things that are components into it. She has like an endometrioma and different things, but I just think that that's a beacon of hope too for anybody listening to this who has endo and is maybe also struggling with infertility, that it's not like a forever no babies for you. It could, there are people that are still getting pregnant. It just is like a much more invasive and intensive path with that.
Yeah. And with endo, it is tricky because to technically diagnose endo, you have to do like a laparoscopic surgery. They go in with a camera and they look around and see, and typically at that time they also remove it, laparoscopically. It is unfortunate. You have to go into a surgery to actually get the proper diagnosis. There are MRIs that you can do that are a rough estimate where you can see, for the most part, evidence of endometrial invasion, but you can't know for sure the extent until you get in there. The thing about endo, and this is something I've learned throughout my practice as well, is that although it's noble to try to do everything from a natural perspective in the endo space, I do believe that it is worth doing the excisional surgery with the right doctor. You don't just go to anybody, any Joe Schmo. Like you really want to go to a really good person. And if anyone needs that resources or support, you can reach out to me on DMs or whatever. There's a lot of people in my membership in Womanhood Wellness that have endo and have either gone through the surgery or going through it now. And so like there's a lot of support there for that. But the thing about endo is it's really hard. You can't necessarily reverse the growth of the tissue naturally, very effectively. You can excise what's there and then prevent as much as you can with lifestyle, herbs, inflammatory support, estrogen support, all of that from it growing back, or at least growing much slower. But if you have full on like endometrial lesions everywhere, it's not like, oh, just take some fish oil, it'll probably go away. Like it just doesn't. And it's kind of not, it's like not worth your time, especially if you're in the trying to conceive season. I would find a really good excisional doctor, even if you have to travel to go to somebody who's good, get it removed, and then do all of your preventative stuff. Obviously, get your body as healthy as it can be before and then after, because there are lifestyle, inflammatory, mental, emotional components to endo. But that excisional surgery is really important. So if you are someone who is either trying to conceive or dealing with really painful periods or with painful sex that's deep on penetration, then it is definitely worth looking into. So yeah, and I talk a lot inside of Womanhood Wellness about what you can do to help your body get into the place where it is healthier to not only go into excisional surgery if endo is part of your picture, also prevent and support after. Or even if you don't have endo, what I teach inside of Womanhood Wellness is so much of these foundational and deep things that are truly holistic, from reducing inflammation, supporting hormones and detox pathways, and also the mental emotional component, it's all in there. So if you're like, I don't know where to go, I'm so overwhelmed, I don't know what to do, consider joining us in Womanhood Wellness. There's an amazing community of women and all of the resources right there. You can ask me questions on all my Q&As. And so I understand endo can feel really, really overwhelming. And all of these things can. Infertility, painful sex, low libido, painful periods, they all can feel really overwhelming. And because it's not a simple pill, you don't just go to the doctor and just get a pill and you're like, oh, I did it. That's why birth control is so attractive. That's why patients and doctors alike love birth control, because if you have endo and you take birth control, it quote unquote like shuts off your hormones. And so it can help with the symptoms, but you're not actually addressing it. And if becoming pregnant is on your heart ever, that is not the solution. Because once you stop the birth control, sure, maybe your painful periods got better when you were on it. You can't get pregnant. But like, there's not a pill to be like, okay, you're on birth control. Now just take that pill away and add this pill, the pregnancy pill. And now you're just going to get pregnant. It doesn't work like that. When you stop birth control, if you had endo and the environment wasn't addressed, the underlying microbiome and detox pathways and hormonal pathways and inflammation and all of that wasn't addressed, you're now trying to conceive in that environment that's not conducive to pregnancy, and it's the saddest thing ever. So even if you are on birth control, whether you have endo or not, and you get off, it behooves you, no matter what you're doing, on or off birth control, to work on these things if you either want to get to the root cause or you ever want a baby. So it's one of the biggest
I love
things
it.
conventional medicine cannot do. They just cannot help with ecosystem health.
Ooh, I
You
like
know,
that. Ecosystem health.
ecosystem health. It's just not something they can do. It's not their fault. It's just not their approach. There's
Well,
not a
they're literally
pill.
not even trained in it. I mean, just in the way
Yeah,
that, we don't do major surgeries. Like you break your leg, you're not coming to me.
right.
you know?
Exactly. So it's not their fault. It's like if
Yeah.
you come to them and you have severely painful periods or whatever, and they're like, oh my God, here's this pill I'll give you, and it all goes away. It's like, oh my gosh, you're amazing. Like, of course, birth control has seemed like this. Oh, like this is this
Mm-hmm.
amazing pill. I take a pill. I don't even have to eat well. Like I can just do whatever I want and all my period pain goes away. Like that's amazing. It does sound like magic until you want to have a baby, right?
Well, and the problem is too is that there's enough people who have still success with those programs
Yeah.
or like protocols to not be so glaringly obvious to change the system yet. It's just like with
Yeah.
inductions of labor, people have friends, everybody has friends and family and whoever who've had a successful induction, everything was fine. So then it's kind of like assumed, well, it's going to be fine for you. It's like,
Yeah.
nope,
Yep.
it's different for everybody. And there is real risk. And we need to just not pretend that that's not there. And then people end up being shocked later when they find
Yeah.
out, oh no, we knew that. We knew that that increased all these risks. And like, sorry, your doctor didn't tell you. Oh yeah, well, they definitely should have. Huh,
Yeah.
sucks for
Yeah. It's
you.
just one of
Sorry.
those
Like,
things.
yeah, it's just, I don't know.
Yeah. One
Anyways,
last
okay.
thing I'll say about endo before I move on to the next one is my there's a very high likelihood that I had endo and probably maybe still do because I had painful periods my whole life. And mine weirdly went away when I got pregnant and had a baby. Obviously, I wasn't on having a period when I got pregnant, but when I was postpartum and got my cycle back, I had no more pain. So some women do seem to have an improvement in endo with pregnancy. However, if you talk to a lot of people in the endo world, they'll say, oh, well, it's just from the hormones of breastfeeding, down regulating stuff. And that once you're done having kids, typically it comes back. Now, I don't know if that's true. I've never actually been worked up for endo. I don't have any painful periods right now. I am still breastfeeding. So
Yeah, but
that
you
is a,
had a time in between. You always forget this. You had a time period in between weaning Avia and getting pregnant with Kate that was like a year,
yeah,
and you still had periods every month and you did not have pain.
I know. I know. It
So
feels like I'm
it's
healed.
really different. No, I do think it is. I hear about this all the time from working with clients.
And maybe it's like stem cells from the babies. Like, I don't know because it's in my family. Endo is in my family. So there's definitely some genetic predisposition. We'll see. I mean, it's possible that my pregnancy literally healed me and it was like my gift from God of like, you went through so much and now you're going to like not have painful periods after you got to this like really hard place that you tried so hard and you'll be rewarded with non-endo anymore. But sometimes I still feel like deep penetrative sex, and for so long, just like so many people, I was like, oh, that's just normal. He's just hitting my cervix. That just happens. And I'm like, well, maybe that's not normal. Maybe like that is a sign of endo and that should never ever happen. I don't know. I don't have any other experience. My husband is not small, you know? And so I don't know. Like it could just be that there's a lot. For a long time
Well,
I was like, I'm just too small and he's too big. And people think that. And it's like, no, that's not
well,
the
no,
case.
I mean
Babies
that
come out of us.
there can be like a literal mismatch. I think there
Yes,
is
yes,
some
there
aspect of
could
that.
be
But also,
for
if
sure.
my cervix hits, it hurts, and I'm like 99.9999% confident I don't have any
Okay,
endo or
see,
anything
then
like
maybe
that.
that's normal.
Yeah, I think it's just like a certain. Although people talk about cervical orgasms, which I wish I understood, because what does that mean? And does it have to be touched? Because I have never enjoyed my cervix being touched,
Yeah, well, I don't
but
know
I don't
about the
know.
cervical orgasm. I definitely have internal orgasms. I don't know if that's the same thing, but that's the
No,
G
it's like
spot
a
that's like
different
that.
thing. It's instead
Oh,
of like
weird.
being, yeah, I don't understand. I
Hmm.
wonder if it's not literally your cervix having to be touched though in order for that to happen, because every time my cervix gets touched or bumped like in a certain position or something, yeah, it's like no, no,
Yeah,
no.
I don't see how that could be. I mean, the G spot like area is kind of around the cervix, but up and tucked. I don't know. Maybe they're like confusing it. We'll see. Anyways, okay,
I don't
moving
know.
on.
Moving on. Electrolytes are trending, yes, but they have been in need of our human bodies for all of time. And if you're drinking another popular and delicious salty electrolyte, here's why you should be drinking Relight instead. First of all, have you ever considered the salt source of these other brands? Because most of them just use table salt. Yeah, table salt. You don't want that. Redmond's Relight Powders uses their unrefined ancient sea salt that they mine in Utah. This salt source contains 60 plus trace minerals along with calcium, chloride, potassium, and magnesium in two different forms, glycinate and malate. The minerals that they use in the Relight powders are all in the appropriate proportions and forms, too. The metabolic needs of pregnancy, healing postpartum, and milk making require more minerals than in other times of your life. Pregnancy itself demands huge increases in your blood volume, which takes, more minerals. Relight is the perfect blend to be sipping during your pregnancy or during your labor even, and especially while you're breastfeeding. It tastes amazing, and my favorite flavors oscillate between mixed berry, lemon lime, and the strawberry lemonade. But you can try a sample pack and try all the flavors for yourself and see what you think. Use code HEALTHYMOTHER to save 15% on your entire Redmond order. That includes their OG sea salt, other seasonings, bentonite clays, toothpaste, and more.
The next big thing, and I'm highlighting three big ones, and I'm going to kind of go on down a list of some of the more of some other common ones. The three big ones I'm mentioning are ones that either I have had or know that I have. Like endo is I don't know, I think. But the two biggest ones that I know I have are coming up next. So one is vaginismus. Vaginismus is basically an involuntary contraction of the pelvic floor muscles. Pelvic floor are just the muscles that hold your pelvis together. So, they allow you to poop, pee, have babies, all of that. It's the muscles that are in that bowl of your pelvis. And they basically contract, so they get really, really tight involuntarily. It's not like you're doing it. When someone says, squeeze, like Kegels are when you squeeze your pelvic floor muscle really tight. And then when you pee, you relax your pelvic floor muscles. And in birth, you have to learn this a lot. And I remember with birth, I was so ready to have a vaginal birth because I'm like, oh, I know my pelvic floor so well because I've had to do so much around it because of all my painful sex. And so I was like, oh, yeah, I can squeeze and release my pelvic floor, like no big deal. But then I never got to have a vaginal birth. So who knows how it actually would have been. But for people, that's how they teach you in pelvic PT and stuff to understand the control of your pelvic floor is like now hold up, like you're holding like a coin in your vagina, and now release like you're peeing. And so what happens is it's an involuntary contraction of those muscles, and basically it makes penetration very, very painful. And this can happen even without sex. I mean, some women have vaginismus with tampons, it hurts. I remember the
Mm.
first time I ever inserted a tampon, it was excruciatingly painful. And so I don't know if I just did it wrong or I've always had issues even before I had any sex. I rode horses growing up. A lot of people will say that if you are a horse rider, it can cause more pelvic tonicity, so more tight muscles in the pelvic floor. I'd had certain accidents and different things, who knows? But with vaginismus, almost always there it's rooted in some sort of trauma. So it is like sexual trauma or medical trauma. So if someone had a really bad first speculum exam, if it was really either painful physically or really, really intense emotionally, or if like first time sex was painful, or there was any sort of religious or cultural conditioning around sex, which connected your brain to say this is not good, this is not safe, or any sort of like chronic stress that creates this hypervigilance, it's a way of the body protecting itself. It's basically saying, do not come in here. You are not allowed in here. I am keeping you out. Like penetration equals danger. And so it's a very complicated condition because it's not only physical, like you're physically very tight, but it's usually coming from a mental, emotional, and like neurological place. And just prying your muscles open with dilators and stuff is typically, in my experience, not the best. When you go to a conventional pelvic PT, that's typically what they have you do is they give you a series of dilators where you start really little, like a little tampon, and then you get bigger and bigger and bigger. And I think you walked in on me once when I was doing my dilation work.
I did because I wanted you to braid my hair. I was like, I took a shower and I was like, oh, I'm gonna have Leah braid my hair, and
We
your
lived
door
together
wasn't
in
locked,
college. Yeah,
but
for
you
anyone who
you were
doesn't
just
know.
sitting on the bed and you had like a towel. I could tell that you didn't have any pants on, but you had a towel sort of over you, like when you go to like a place to get waxed or whatever, and like they just give you like a little hand towel to put right on top of your like vulva,
Mhm.
and you were just like reading a book in your bed. I was like, oh,
Like
oh.
just like find a relaxed place and insert the dilators. Like you guys, I've done every single thing you could ever imagine. It's insane.
She
And
still braided my hair. I want everyone to know.
I
I sat on
did.
the edge of the bed and you braided my hair,
I
and I
did
knew
still
what you were
braid your
doing when we
hair.
talked about it. And we left.
That's what girls
Oh.
do. This is girl time. And I had a sexual trauma. Like I said, my first time wasn't my choice, and then it was painful ever since. And again, I'm wrapping my whole story back into this as to why I think there's multiple contributors. But that pain just reiterated the penetration danger pathway in me that not only was it the first time, it was repeated times for years and years and years that just continued to build that neuroplasticity of this activity, this thing is very scary and painful, so shut it down. I also was raised very Catholic, and very shame around sex, was a big part of my upbringing. It's not my parents' fault or, necessarily the religion's fault, but it kind of like there's a lot of shame. And so the analogy that I always use around my painful sex is imagine that you grow up being told the stove is hot. The stove is hot and it's going to burn you. Don't touch it. You don't want to touch the stove. The stove is bad. The stove is hot. Don't touch it. And then somebody forces you to touch it and it burns you. And then the person you love wants you to touch the stove every night. And you're just like, what? This is like, no, I don't want to touch the stove. And then you just get burned over and over and over again. And pretty soon your body, like, as you even walk toward the stove, is like, don't put me toward the stove. Like, I don't want to get burned again. Like, this is insane. Like, I grew up my whole life knowing this is bad. And then it happened and it was terrible. And then it's been terrible ever since. Like, what body craves that, So for me, when I talk about low libido is very complicated, but the root cause of a lot of my low libido has been pain. That is not everybody's situation. But it's like, yeah, how would you want or crave something that hurts you so bad? It's not rocket science, right? Go
Okay,
ahead.
I have a question, and I love that analogy. It's so true because even if it's like with somebody safe, it doesn't matter. Like body keeps the
Mhm.
score kind of thing.
Yeah.
Um, okay, but question is that I understand that vaginismus is a contraction, an involuntary contraction of the pelvic floor, but then
Hmm.
does it just like pelvic floor is we're also when we say pelvic floor, we're thinking of like the vaginal canal because isn't it the vaginal canal that and like right specifically in the opening that's
Hmm.
getting all tight? Okay, so like the
Yeah.
whole area is just going nope.
Yeah. Yeah. Like that vaginal opening would get tight. Like if you were trying to put a tampon in, like you could hardly put it in because it's like it's gotten so tight that canal is so narrow and then you're trying to force it through. And then it's painful, right? Because of that.
Okay.
And so the way that the approach of normal pelvic PTs is they call it like desensitization, where that's what the dilators are for. It's like we're trying to like tell the body that it's safe. I'm not opposed to that, but I think there has to be another layer of support that is dealing with the trauma piece. You have to be doing mental emotional trauma release. You have to. Because vaginismus, for the most part, is coming from the brain, and it is exactly like the body keeps the score. It's a trauma response that's held in the tissue, but also it's in the subconscious, right? You can consciously want to have sex. You can consciously want it to not be this way, but it's subconsciously happening, which is where hidden root traumas, all of that lay. And some people have even had sexual trauma that don't even realize it because it was either so traumatic that they sort of forgot about it or when they were a kid or something. And so if you're dealing with something like this, and the way that this feels is burning, tearing, or hitting a wall. So, like the way that I would have described it is literally like a knife. Like a hot knife was put in a fire and then like trying to ram that up into your body. Like it's
Oh
terrible.
my
It's like a
gosh.
terrible, terrible situation, but it's burning. It's very burning, tearing, terrible, terrible pain. And, no amount of lube, no amount of anything. It's like, but this is the thing is you have to retrain the body. And it's really hard to do that when you also are like in a marriage or a relationship where you're also trying to support. And so like, my husband and I, we've gone months, year almost at many times without anything, thinking, oh, it's going to help like give my body a break. But if you're not working on all of the root stuff, it doesn't matter how much time has passed. The body remembers. And it's like, oh, I remember that. That like really, I have to keep myself safe. So there's a lot to do to kind of unravel vaginismus. And I will be working on releasing my painful sex course soon, sometime this year, I'm sure, because it's so important. Where I'll kind of dive deeper into all of the things, because it's very comprehensive. But just know that it takes more than just dilators. For me,
Yes.
though, I did have to bring in like a vibrator into our practice. And what's so interesting is I've had to just learn all this stuff on my own without anyone like telling me or really understanding and trying to learn about the physiology of how it all works. And it's so complicated. And I mean, sex itself is really complicated. We don't even know that much about it. But what's interesting are the pain pathways and the pleasure pathways are very closely related in the nervous system, which is why there's a lot of, people that have interlocking or interconnecting fetishes and things of like pain and pleasure. But vibration, I remember just specifically in naturopathic medical school when we were studying neurology. I loved neurology. There was a time before I had kids and I had more energy that I wanted to study like complex neurological conditions. I don't know what I was thinking, but it fascinated me at the time when I was young and sprightly and not exhausted. And I remember learning the spinothalamic tract is a part of the nervous system that carries pain. And interestingly, it's the same part of the nervous system that carries vibration. And I was dealing with this during medical school because my pain started when I was 18. So I'm sitting here, I'm already half a decade in, and I'm sitting in class being like, you're kidding. Like, pain and vibration are on the same path. So if you use vibration, it blocks pain. And it literally blew my mind. I had never thought about using a vibrator. I had never thought about any of this stuff or how it was helping. Or maybe I had been using a vibrator because I just had found it out. I just figured it out that it hurt less if I did that. And when I learned that, I was just like, oh my gosh, no wonder. Not only do vibrators help with like sexual stimulation and stuff, but it actually blocks the pain pathway. So that's not necessarily getting to the root cause, but it was a very effective tool for me and something that like changed my life at the beginning part of this stage. So yeah, that was just really interesting because I would have to kind of trick my nervous system into being like, this is okay, like you're gonna be fine. But that wasn't getting to the root cause. After I had my daughter, it was less painful because the whole time during my pregnancy, I was doing some really intense mental emotional trauma release work. And I did that because I was like, I don't want to pass this trauma on to my daughter through childbirth. And I want to make sure that I can have a vaginal birth and that I don't have anything mentally holding me back from having a vaginal birth. And so I met with a woman like every week for almost my entire pregnancy. And I would cry and we'd process. And it was amazing. And I really do think that journey was a big part of how I got there, and why I think there's multiple things hormonally and that piece as to why it was much better postpartum, which is just an interesting conversation.
Little piece. And we have an episode about birth preparations for sexual trauma survivors that I will put in the um, show notes as well, because it is a very completely missed shadow topic. I don't know. It's like nobody wants to talk about it. But
Mm-hmm.
so all that work is like so important to be doing, you know, and I know there was like multiple layers of why you were doing it, but I think that that's something that unfortunately is so common, women having had sexual trauma experiences. And then a
Mm-hmm.
lot of the time they won't even think about how it could potentially interplay or affect birth.
Mm-hmm.
And it absolutely can. And there's ways to kind of prepare for that and circumvent some of these like, you know, triggering moments and things.
Yeah, and there's still a thought in my mind that my body wasn't ever able to fully dilate and go into labor because there was still some held trauma, in my cervix and in my body in general, because it's what, like 16 years at that point of trauma, you know, that's just a lot of trauma because it was painful, even with my husband and stuff. So, anywho, that brings me to the next piece, which is the third thing, something I discovered recently that I did not know about. And again, to some people being like, duh, how did you not think about this? So whenever I'd go into the doctors and talk to people about it, no one really knew what to do with me. It took me a really long time to even start exploring this because for a long time, I just was like, oh, this is just bad luck. Me and my husband are just not well fit together. Like I've been on all the spectrums of like the understanding. And a lot of people would be like, oh, well, do you have low estrogen? And I was like, no, I have so much estrogen. Look at my labs. I have like estrogen dominance. I have more estrogen than you could ever imagine. Like, what is going on? And it's because, and I had this thought, and this was long, long ago, because I was on birth control, it lowered my testosterone. And there's a whole mechanism of how that happens. There are certain birth controls that lower testosterone more than others. It raises sex hormone binding globulin, which binds up all your free testosterone. And so that was a big part of my libido picture as well. So I had pain and I had low testosterone. And those were my two biggest root causes for low libido. And I knew that the low testosterone was from birth control. I'd seen it on labs. I knew it. I had studied that mechanism. Again, when I discovered that in school, I was like, I have to like learn everything I can about this. But then what happened is that we found out about our fertility. So 2 years into medical school, we find out that my husband has no sperm. And so we start trying. And when you're trying to conceive, you can't take hormones, especially not testosterone. You do not want to be on testosterone when you're trying to have a baby as a woman or a man, either of them. So I didn't even think about it. I tried all these other things. I tried DHEA. I tried a bunch of stuff. And everyone would be like, oh, do you have low estrogen? I was like, no, I have so much estrogen. But then, obviously I kept moving on. I was like, it's surely not a hormone issue. I have lots of hormones, but it's maybe a low testosterone issue. But how does that even make sense? And maybe I need to take testosterone and all this stuff, but I couldn't. And they were just thoughts that I had in my mind, knowing I had a hunch. Anyways, I'm in my pelvic PT's office after my second postpartum with my son, and I see a book on the table called When Sex Hurts. And I was like, oh, I should check that out. I've never heard of that. So I get it on Audible and I'm listening to it. And it's similar to this podcast. They go through all of the mechanisms. They're a group of doctors who deal with painful sex, but it was written in 2018. I mean, this was years after my stuff was happening and we were deep in our fertility stuff. So the pursuit of trying to fix the painful periods took kind of a back seat in a way. And so I'm listening to it and they mention this thing called PVD. And I had never heard of it. It stands for Provoked Vestibulodynia.
I can assure you almost no one here has heard of that.
I know. I was like, how have I not heard of this? I have been trying to fix this for so long. I am a doctor. What in the world? And they're like, yeah, the pain is burning, raw, stinging, feels like acid on the skin or a fresh wound right at the opening of the vaginismus. You guys, I had been to practitioners where I'm like literally a cotton ball. Like if you touch the opening of the vagina with a cotton ball, it hurts, excruciating. If you pushed your finger on the opening, it would be like 10 out of 10 pain. I'm going to jump off the table. And I have a pretty high pain tolerance. Like I do. I feel like I do. And I always would tell them, and especially this is the thing, as I would tell doctors, oh, I have pain with sex. And again, no one even asks the questions. They would assume it's like deep pain or they just didn't understand. And I would always be like, it's at the opening. It's so weird. It's like right where it opens. Like, what is that? And like, no, I don't know. Like, and so I would like do these like even somatic practices where I would do like breathing exercises, even with Mike, where I'd like breathe in and he would like push on the side of the tissue and it would hurt so bad, like you guys, excruciating. And we'd do it every night and practice and be like, okay, it's getting a little less. Like that's that desensitization type of picture.
But it wouldn't, like if you were to poke around other places of your vulva, no pain.
Correct.
Wow, only at the introitus. So the technical word is introitus, is like that opening of the, wow, okay.
And I was always like, this is so weird. And I never knew why, but it was just my lived experience. And I'm listening to this book and they're like, oh yeah, PVD, provoked vestibulodynia, which the vestibule is the opening. And it is provoked, meaning if you touch it, if you push on it, it is provoked pain of that opening. And I was like, wait, there's an actual thing? Like this is an actual medical thing? And then they're explaining like, how it happens and blah, blah, and where it comes from. And there's something called congenital, which means you're born with it. There are certain differences in the receptors of the hormones at that tissue that set you up for more vulnerability. So sometimes people can be born with it, but then something like birth control. So there's different types. There's congenital and then there's hormonally derived PVD. And hormonally derived means there's some sort of hormonal shift or change that causes it. For a lot of women, it's postpartum. So this is actually a common cause of postpartum pain when you have sex with pain with sex postpartum. And a lot of doctors even know that to just give, a little bit of hormones, a little vaginal estrogen or whatever to a postpartum mom. But just like everything else, I've always fallen into this category of windows that aren't what's normal. It's very common for postpartum women to have this. They know they have no hormones. They're like, you have no hormones, so you need to take some bioidentical hormones to help with your painful dry sex. And it's like, here I am, this young, reproductively normal woman who has lots of estrogen. What is going on? No one would ever talk about testosterone, ever. And I would always bring it up. And it's like, I know I don't have low estrogen, but I know I have low testosterone. And they're like, oh, well, maybe it shouldn't matter. But what happens is, like, about this thing is it's not about what's circulating in your body. It's at the tissue. It's at the tissue level. So I could have all of the estrogen and testosterone in my body that I wanted, but the tissue itself is not getting the proper hormones of testosterone and estrogen. And so it makes that skin really friable and thin and sensitive, and it causes this like nerve pain that is excruciating. And the number one cause of hormonally derived PVD outside of postpartum is hormonal birth control. And so when I met my husband, I got on birth control right away. And so not only did I have the trauma and the vaginismus, potentially endo, I also was on birth control. So I had this double whammy of this PVD this whole time. And so I was doing all these treatments, but like one was treating one and one was not treating the other. And it was like, once I solved the vaginismus and did all of this healing, I still had this other pain. And it was so confusing because it was multiple factors like interrelating. And for me, even after I stopped birth control, it must have still happened, or maybe I have congenital issue. And so I was more susceptible, and it's just like something that is just, I'm going to have to deal with my whole life. I don't know. But I just remember reading that and being like, oh my gosh, this must be it. Like, this has to be it. And I'm now in a season that I can actually address it because I'm not trying to conceive. And so, yeah, I've gotten some support for that, and it has like completely changed my life. However, I just want to caveat, I don't think if I had gone in 10 years ago to just get hormones that it would have helped everything, because I still had the vaginismus, which was all rooted in trauma and all of this deep stuff. Because I tried DHEA, I tried all of that back in the day, and it didn't do anything, because I think that I needed to release all this deeper stuff because there was so many multiple factors. And now all of that was healed. It was like all that was left was this, postpartum, and I'm postpartum, so it's even worse. So anyways, all that to say, I now feel very confident that I have two, potentially three things going on. And I have fixed over an 18-year period all of them, or at least have tools for them. And it's very exciting because it's such a chronic, horrible thing. But I just want to give people hope that I've been through the trenches. I know what it's like. And if you can find your root cause and address it appropriately, I really do believe the body is so amazing at healing.
Okay, so now for you, you know the touch does not, it's like nothing.
So it's not nothing. I would say it's reduced it by like 90%.
So it's like a
And
teeny tiny bit of
and I
uncomfortable.
wasn't even able to like be adequately lubricated, and then that makes more pain because it's like the cells in my body. And then, you guys, sex is so complicated because as soon as it senses danger or threaten, you go into sympathetic nervous system, and
It's
that
just like
immediately,
birth. It's just like
yes, it's
birth.
just like birth. It immediately
Hmm.
dries up everything that could
Yeah.
be juicy and like lovely for sex, because your body's trying to protect yourself. And it's a vicious cycle. So then there's more pain, there's more dryness and more pain, even with lube and all of that. And so it has just been a vicious cycle. And so it is the first time, like, I still use a vibrator. So I am trying to continue to build neuroplasticity because I know so much about how it works. I'm like trying to biohack my own painful sex. I don't want to have an experience of pain anymore. So I used to just take it. I would literally just be like crying, like Mike wouldn't see it, like feeling like I'm being stabbed with a knife, like trying to hide it from him because I tried everything and I couldn't figure it out. I don't let that happen anymore because that was too many years of neuroplasticity of telling my body that this is dangerous. But the solution for us wasn't just abstinence. Like, people are like, well, just don't have sex. I'm like, okay, well, that's not a solution either. So the vibrator became my best friend in this regard. I still use it because it helps with like clitoral stimulation, which is really helpful for, you know, just arousal in general. And so I don't want to have an experience of pain. But now, since, supporting my PVD with like just a tiny amount of hormones, there's like no pain. With those two things, zero. Whereas before, there would always be pain, but I would override it. And it's like we could go forever. We can go multiple times. I'm like, this is insane. I've never had this experience ever in my entire life. And so it's just really cool. It's
Oh
just
my
really
gosh, it
cool.
makes me so happy for you.
Thanks. Yeah. And so, I just think, again, it's all about getting to the root cause. If your heart aches for a baby, whether you want a baby someday or you've already been on the journey and it hasn't been as easy as you had hoped, I want you to know that you don't have to do it alone. I created Womanhood Wellness for women just like you. Inside of this amazing membership, you have step-by-step doctor-designed blueprints unique to your womanhood type based on the season that you're in. You have access to order your own labs. You have over 22 amazing courses and growing that I have created for you, all about breaking up with birth control, balancing your hormones, preparing your body for pregnancy, optimizing your fertility, and navigating the root causes of infertility. I have support for pregnancy loss, for navigating integrative IVF, for supporting your partner throughout this process, as well as information about libido, which is one of my favorite things to teach about, because when it comes to womanhood, it's all connected. On top of the amazing content and resources, such as being able to order your own supplements and the protocols that I have, all of the step-by-step checklists of exactly what to do within each lesson in a basic, intermediate, and advanced path. I also have amazing support inside of the membership. Every month you get a live Q&A with me. I have monthly masterclasses taught by me and other amazing practitioners. And bi-weekly, we have connection calls where you get to really connect with women and share and feel seen. We have seasonal circles that are unique to the different seasons of womanhood. For example, if you are breaking up with birth control, or you're struggling with libido, or you are trying to conceive, maybe you're going through IVF, or you've had a pregnancy loss, all of these different scenarios require different support. And so these circles put you together with women just like you so that you can really connect and make long-lasting friendships. You'll finally understand your cycle, your labs, your body, your fertility, and you'll feel empowered in your womanhood journey. So if this sounds exciting to you, I encourage you to go to womanhoodwellness.com and use code podcast to sign up and save 20% on your first month. Again, head to womanhoodwellness.com and use code podcast to save 20%. I can't wait to see you inside. I'm just going to run through a few other ones that we haven't talked about that could be going on if you're someone who's dealing with this. Like I said, paying attention to where the pain is, what you're experiencing is a big clue. And then starting to kind of figure that out. And I'll be sharing this all in the course that I make of kind of, what the pain is like and where to go. But some other things to just keep top of mind. Recurrent infections or dysbiosis. This is, bad bacteria in the vagina, yeast infections that can cause issues. Lichen sclerosis is another one. That is where there's kind of like a plaque kind of thing that can happen, and it can be all over the vulva and not just in like the opening. So if like the whole area hurts, or it hurts to ride a bike or sit down on a chair, like that could be something. It's more dermatology is lichen sclerosis. You can have scar tissue from birth. So some people have episiotomy scars, so that can cause pain at the opening, or even just from tearing. Even if they didn't have an episiotomy, there can still be scar tissue that can cause pain, or any sort of surgery anywhere, that can lead to issues. There can be
Or
some.
or
Okay.
granular tissue that takes a long time, and that wouldn't persist beyond like a couple of months postpartum, but still like as
Yeah.
the tear or the sutures are healing,
Hmm.
sometimes it can be a prolonged bit of healing there. Yeah.
Yeah, but again, it's like that's where it's important because if you have an episiotomy scar, one, there could be trauma to release there if it's like from the past. Because I know of older women who I've seen who are postmenopausal who are still having painful sex, and a lot of it is in that area where they had an episiotomy, 20 years ago, 30 years ago. And so, yes, it could be the scar itself, but it could also be the trauma that gets trapped there. Scars trap trauma. And so there's just so many more things going on. Um, so again, like inadequate lubrication can do it, but that can come from a lot of different things. There can be autoimmune or inflammatory diseases, not feeling safe in your relationship. So I have a very loving and safe relationship, but some people maybe don't. And that can still create this fear response, even subconsciously. So that's something to look at. There can be neurological pain syndromes, like pudendal neuralgia is something where there's actually a nerve that gets kind of trapped. That can happen. You can also have overreactive nervous system, which I do think like PVD is sort of a form of that. If you've ever heard of fibromyalgia or interstitial cystitis, these kind of things can be an inappropriate nerve response. So for someone with fibro, you could touch their shoulder like very lightly and it would be very excruciating pain to them. And for a long time they were told it's all in their head, they're making it up, and it's like no, like pain is pain, it's confusing. There's no way to compare pain one way or another, but it's usually an inappropriate nerve response versus them just making it up in their head. Yes, it is in your head because it's in your nervous system, but the nerves are having an inappropriate response. So that can happen as well. And then, yeah, like body image issues, relationship stress, sexual conditioning, all of these can just create the connection between the brain and the body to not be ready or wanting. And if you're not open and receptive, the body is not open and receptive, and then it can cause pain. So it doesn't even have to be something so medical or so intense. But that's kind of a quick, not quick, a whole overview. That's
Oh,
basically an entire course for you on unpainful sex and the root causes. And yeah, you heard my whole vulnerable story up in there, but I'm okay sharing it. My husband's okay with sharing it because I wish that someone had told me about this, in my life. And I just think that the things are so taboo that we don't talk about them and then no one gets support. And that's so silly. It's like, I don't care what you think about me. If I can help you, I'm going to do it.
I love that. Thank you for being so vulnerable and continuing the pursuit of figuring this out so that you can help yourself, but also be able to help so many other people. And on this list, a couple you just didn't mention that I want to say are like urinary tract infections or interstitial cystitis. So that's like a bladder inflammation that's not because of infection, but often can have like an autoimmune or just some sort of inflammatory, like sometimes associated with celiac disease, something like that. And then also, I
Mm-hmm.
wanted to say when you were talking about horseback riding,
Mm-hmm.
so for a lot of people, I talk about this all the time as it relates to birth specifically, and then postpartum and pelvic floor health. But I think there's this misconception in the US, at least. American women want like tighter vaginas, tighter pelvic floor, kegels, kegels, kegels. And there, a lot of the pelvic floor dysfunction that is happening is actually because the pelvic floor is too tight in so
Yeah.
many people and they don't know it. They're just walking around sucking your belly up and in, or you have a
Mm-hmm.
history of being, yeah, a horseback rider, a yogi, a dancer, ballet, bar, like BARRE. Not to say that these things are bad, you need to avoid them, but these are the types of people, or gymnastics, these types of people, though, have been trained to have really strong core stability and to find their core stability in like often sucking up and using their pelvic floor in those motions. And
Mm-hmm.
it can be really difficult to have the full muscular health spectrum in those cases where you have full relaxation too, because your muscle belly needs to be able to contract and relax.
Mm-hmm.
And if it can't relax, then there's dysfunction that happens from that. So it can affect birth negatively. It can certainly affect your postpartum, like with things like incontinence. So now, you're sneezing or you're even just walking around and you're peeing yourself because there's not, there is, if imagine if the muscle is all the way tight, it can't get any tighter. And so
Mm-hmm.
if there is like a need for it to be able to have fluid dynamic, contraction, relaxation to go along with your sphincters as your body just moves around in space, it won't be able to do that. So it's one of the reasons why I really do uh, recommend women in their pregnancy even to find a pelvic floor PT, get assessed, because I had no clue that I had an overly tight pelvic floor until I was postpartum with my first baby. Went to a pelvic floor PT in San Diego. Shout out Dr. Lauren Malari Snyder at Thrive Pelvic Floor, or sorry, Thrive Physical Therapy. She's the best ever. And I remember she was like doing an assessment on me, and she's like, "Okay, now relax." And I was like, "Okay." And then she's like, "Okay, now relax." And she's like got her fingers inside. And I'm like, "I am." And she's like, "No." No.
Hmm.
And she basically diagnosed me with having a 70% tension at all times in my day of my
Hmm.
pelvic floor, unknowingly, unconsciously. And it actually really was so like healing for me to hear that, because I do think it affected my birth negatively. And I
Hmm.
remember my midwife also holding a couple fingers inside and being like, push right here when it was time to push. And I could not connect. Like, I did not understand what she meant. And she was like, relax this. Like, what are you doing? Relax. And I thought that I was, and I couldn't more. You literally have to almost pee. You have to feel
Yeah.
like you are actually almost going to pee.
Yeah.
And so I just wanted to say that for somebody who's listening to this that's like maybe only experiencing, or I don't know, you're just being preventative. If you're one of these people, or you are a big like weightlifter and
Hmm.
now you're pregnant, it's really a great idea to get established with a pelvic floor PT, because now you already know them. You're already a patient in their system. You can figure the whole thing out. You know where the office is. It's not so overwhelming when you should
Hmm.
need it, like later on when you are maybe postpartum. But also, if you're curious, they can do an assessment now to help you learn how to relax and functionally work your pelvic floor, work with it so that it doesn't have negative effects on you later. And then if you're somebody who trains a lot, lifts a lot of weights in your pregnancy, it's very important. You can still do that. I used to not be very supportive of that because I felt like people are only going to hurt themselves, but it's just not true. You can lift properly in pregnancy, but you need to ensure you are engaging your pelvic floor
Hmm.
correctly during your lifts so that you're not going to hurt yourself, so that you're not going to exacerbate a diastasis recti, which is like, where the abs separate in the front of the belly too much and then they don't come back together. Or,
Hmm.
you hurt one of your joints or something because of relaxin hormone. So I just wanted to say that at the end there, when you mentioned the horseback riding, that, yeah, there is like certain activities that we do as women sometimes that
Yeah.
can make this be a little bit exasperated. And it's not like you don't do them. You just know that. You just have that awareness in the back of your mind that you're like, oh, I might have to. Because for me, have I only tore one time, was my
Hmm.
first baby. My second baby was the exact same weight, over 9 pounds, and I really learned. She taught me so much about diaphragmatic breathing and how to connect with my pelvic floor. It was such a lifelong skill that I've had now forever. And I have no, I mean, like, knock on wood, very, very lucky with this. Immediately postpartum, like, maybe I like, if I jumped on a trampoline, I would pee or something. But
Hmm.
overall, my pelvic floor has been really great. And I've been kind of surprised about that. We'll see what happens when I'm postmenopausal. But, you know,
Yeah, I mean, and I'm glad you brought it up. And actually, let's add that to my fourth root cause of my issue is I think I've always had hypertonicity as well. It's one thing that I also was diagnosed with PT. But I remember my mom as a kid when I was a teenager and I didn't want to be like fat or whatever, which I was eating gluten and dairy, which made me so inflamed. I didn't really think much about that. I remember my mom telling me one time, she's like, "Oh, well, just suck in your belly and it'll go away." And it's like, what a silly thing to say. But what ended up happening is that I did like create a lot of core strength, and I would sit on the edge of my seat, and I would be like the perfect like straight backed tummy tucked in, like sucked in my whole life. Like I was always just like a very tight core. But what changed for me, I will also give a shout out to a pelvic PT. I think everyone should see a pelvic PT. Every woman should see a pelvic PT at least one time to be assessed, just like you go to the dentist, because you need to just know, do you have hypertonicity, meaning tight, or are you super lax? This helps with your sex life and with birth. But what I loved about Sarah Graham at Restore PT in the Boise area is she was also trained in craniosacral, but she would do internal work, but really like almost massaging on the inside. And she would identify tight muscles that she's like, oh my gosh, like she was like, this is one of the tightest I've ever felt, in a pelvic floor, but she would release it just like when you go to a massage therapist. And that, not like right at the entrance, like deep in my pelvis. I mean, you can stick your finger around and just go right up in there, way more than a midwife or anyone has ever done. They just get in and get out. This is like really relaxing those muscles. So if you can find a pelvic PT who can do that, if you are someone who has a lot of hypertonicity, it helped me so much, even though I wasn't able to have a vaginal birth for other circumstances, just in my own life in general. She also said it's very obvious you've had a tailbone injury, either from falling off a horse, snowboarding, something. And that also can cause dysfunction in your pelvic floor that can lead to painful sex and all these other things because your tailbone or your coccyx gets, ruined. And then I actually did it the other day when we were rollerblading together, you and I, Morgan.
I'm so sorry.
Lots of tailbone injuries, but that's another thing to have them assess because that can also be a contributor. So there's so many things, and like we've learned so much. So we just want to share all of that wisdom with you of go get checked out. There's so much that can happen that can be contributing, and it's like a one-stop shop, easy way to get assessed for your pelvic floor. So.
I'm amazed at Lauren did some of that like trigger point therapy on the inside of my vagina too after Gage was born, and it was a new concept to me. I did not know that your vagina could get like knots in it. And it totally can. It gets these adhesions or knots just the way that your shoulders do. And she would literally just hold it and it would be intense burning pain for like 30 seconds and you breathe through it and then it just melts away and then it's gone. Yeah. And I do remember, we had some like a little bit of uncomfortability with sex, more than I was just like nervous. And I did have a big tear. I had 10 stitches. From when he was born. The kid just blew me right open. So, I had to work with that tissue because actually it didn't heal right. My body rejected the stitches. Anyway, whatever. But they're just magicians, okay? Everybody needs a pelvic floor PT. We highly recommend it. So anyway, thank you, Leah, so much. This is really, really helpful. Look forward to hearing about your course, and it will be linked in the show notes at any point whenever it comes out, so people can find it and figure out their root cause for them, and then start to have more enjoyable, awesome sex.
Yeah, and if you guys want to ask me questions now, feel free to join Womanhood Wellness. The course isn't going to be out, but it will be open to anyone who's a member, and I have live Q&As. You can go and ask me questions if you're like, I need to talk to you right now. So go check that out at womanhoodwellness.com. It'll be all good.
All right, thank you. Bye.
Bye. In order for others to hear this information, please leave a review with Apple Podcasts, subscribe, and share with a friend who would benefit from this content. Please remember that the views and ideas from this podcast are for informational purposes only and are not intended to be a substitute for medical care of any kind, including the diagnosis and treatment of any disease. Consult with your provider before integrating any of this information into your own healthcare plan. A healthier future starts now, and it starts with you.